Welcome to the online learning modules for the Registered Nurses Union Professional Practices Toolkit. Before we begin, here are a few things to be aware of. Note that the use of the term collective agreement throughout this presentation refers to the Maine Provincial Collective Agreement signed September 2014. The use of the term patient throughout this presentation refers to patients, clients, or residents across all practice settings. For specific professional practice information, refer to the most current collective agreement or transition agreement that applies to your workplace. This module will advance the slides automatically. You can also use your mouse to manually move forward or back. In the new toolkit, you will find a new professional practices booklet that provides detailed guidance on what issues should be reported, how to document effectively, and how to follow up. Also included is a professional practice card to wear on your lanyard. This two-sided card will help you recognize and document a professional practice concern on the spot. Quick access to the information you need right at your fingertips. The toolkit was sent to all RNU members in the mail. New members should receive the toolkit in their RNU welcome package. It can also be accessed on the members-only website, My RNU. The online learning modules are meant to reflect the content in the toolkit. There are four major components that will be covered. Module 1, Professional Accountability. Module 2, Process for Resolving Professional Practice Issues. Module 3, Documentation. Module 4, the Professional Practices Committee. The various tools found in the booklet will be discussed throughout the modules wherever they are applicable to the content. At the end of each module, you will find a self-assessment quiz to test your understanding of the information. The online learning modules are an excellent resource to use in a branch meeting or to host a lunch and learn session while earning valuable points towards your nursing practice and leadership premium. Most of all, they provide the flexibility to learn wherever and whenever is convenient for you. The toolkit has been developed in response to our members' needs. Members have voiced uncertainty around how to identify a professional practice issue, how to use the professional practice processes, and how to document concerns effectively. It has been prepared to assist members facing professional practice situations that make it difficult to provide safe and quality care within their scope of practice. It will help you understand the professional practice processes as outlined in the collective agreement and use it more effectively to address your concerns in the workplace. The leadership and staff of the RNU are committed to ensuring that the current professional practice process is understood by the members and use it effectively to address workplace concerns. The Professional Practices Framework was developed to guide us in this process and is reflective of our organizational strategic plan. The framework serves as a basis for this process. RNU is committed to the following framework: to provide professional practice resource material to the membership, to support members to continue to complete the professional practice forms, compile necessary information, and refine recommendations as needed, to facilitate the process according to the collective agreement, to encourage members to utilize the process, and to act as a liaison between members and employers in setting up a PPC meeting. There are four principles or beliefs that underlie the framework on the previous slide. They are: the professional practice process can be a quality improvement and employee engagement tool. Respectful and genuine dialogue between RNs and their managers is the foundation of the process. All parties have a responsibility and accountability to the process. The most effective approach to resolution of professional practice concerns should be at the lowest level whenever possible. Now that you understand the basics for the toolkit, we will move on to talk about professional accountability. The rest of this module will outline the registered nurse's duty to identify and address unsafe or unethical concerns, examples of professional practice issues, and how to recognize a professional practice issue. All registered nurses are licensed and regulated by the Association of Registered Nurses of Newfoundland and Labrador, who have the power to regulate the nursing profession through the Registered Nurses Act and the Standards of Practice for Registered Nurses. All registered nurses are responsible to know and understand the standards and how they apply to their practice. Registered nurses are also expected to adhere to the Canadian Nurses Association Code of Ethics, which provides moral and ethical standards by which registered nurses are to practice. You can visit the ARNNL website for the full Registered Nurses Act and Standards of Practice. Following the Standards, Registered Nurses Act, and Code of Ethics is what makes each and every single registered nurse accountable to the public and provides a yardstick against which to measure the performance of nursing care. Often registered nurses are faced with complex situations in which she or he feels challenged to meet the minimum standards of nursing practice. It can be a dilemma if the registered nurse is practicing according to his or her professional standards and ethics, but feels a lack of control over their work environment or encounters an issue that is beyond the ability of individual registered nurse to resolve. It is the registered nurse's duty to identify and address unsafe or ethical concerns or issues that impact one's ability to practice professionally. It is a professional, ethical, and legal responsibility arising out of the registered nurse's obligation to protect patients from harm and to uphold the integrity of the nursing profession. So what is a professional practice issue? If we look to the collective agreement, it gives us some answers. Article 5.02K states the intent of the Professional Practice Committee process is to discuss concerns related to patient care, workload, nursing practice, or the safety of patients and registered nurses. Furthermore, it can be any situation in the workplace that has or could place patients or registered nurses at risk, interferes with the registered nurse's ability to practice in accordance with the standards of practice, the Code of Ethics, the Registered Nurses Act, or other legislation, workplace policies, procedures, or other relevant standards or guidelines, and is beyond the ability of any individual registered nurse to resolve. There are several examples or indicators of professional practice issues. Let's explore some of the indicators in greater depth. Staffing levels. If you work a shift without enough staff to provide safe, proper, and adequate nursing care, you must document the situation. Documenting staffing levels is especially important in areas where new models of care are being implemented, such as variations to the Ottawa model of nursing care. Be aware of the skill mix and the numbers of all staff in an area and advocate for more when necessary. Communication. A professional practice issue can occur when communication fails or is not used effectively. It can be the direct result of ineffective communication, lack of leadership, or when the registered nurse does not feel supported. Using effective communication skills can enhance the problem-solving capacity at the lowest level before it escalates up the organizational chain or hierarchy. Be factual and clear about the issue at hand. Education and orientation. Situations may occur in which a registered nurse may not receive an appropriate orientation and education. The orientation period could be too short, unavailable, or not have enough content depth. Registered nurses should receive an appropriate orientation to their work area, which should include general orientation for newly hired or transferred registered nurses, specific orientation programs for individual units, example, critical care or labor and delivery, float orientation, orientation to new and existing equipment, example, IV pumps, lifts, monitors, and current policies and procedures. A professional practice issue can arise if a registered nurse feels that he or she has not been provided with the proper orientation or workplace education, which could constitute a possible risk to patient safety. Environment. Environment refers to the physical surroundings and/or inappropriate placement of the patient. Physical inadequacies in the environment may include inappropriate design to meet patient needs, inadequate security, noise level, renovations, etc. Inappropriate placement of patients may include an aggressive patient in a non-secure unit or a patient in a hallway who requires isolation. These situations pose risks to the safety and well-being of patients, registered nurses, staff, and visitors. Equipment and supplies. This refers to any issues regarding equipment and supplies that affect patient care and include lack of, faulty, or inappropriate equipment and supplies. For example, a professional practice concern may occur if there is an inadequate supply of pediatric blood pressure cuffs in a pediatric area, or outdated glucose monitors that have not been calibrated. Often these situations can be resolved through simple conversation with your supervisor or manager. Job description and duties. This can include a role that lacks a proper job description or one that does not clearly identify roles, responsibilities, or duties of the registered nurse or other employees, including clerical or unregulated care providers. An unclear job description can contribute to a professional practice issue. Medications. This may be a situation where registered nurses have concerns regarding inadequate or outdated medication and/or supplies. Other areas where a professional practice issue can occur are access to medications, administration or dispensing, pharmacy-related, processing orders, and supply. Non-nursing duties. Addressing non-nursing duties is an area that RNU has focused on in collaboration with employers and the provincial government. We recognize the performance of such non-nursing tasks can greatly impact the level of nursing care provided to patients because registered nurses use critical time on these tasks. Performing non-nursing duties greatly contributes to nursing care that gets delayed or missed. A professional practice concern can arise when the registered nurse is involved in non-nursing functions such as answering telephones, portering, visitor inquiries, ward unit clerk duties, and cleaning beds, removing meal trays, etc. Policies and procedures. It is the responsibility of the employer to ensure proper policies and procedures are in place that clearly state what registered nurses are allowed to do or not do in their practice environment. For example, registered nurses may administer specific medications by IV push in the critical care area, but not in other practice areas. Or there may be a policy that specifies a registered nurse must accompany a consciously sedated patient to the X-ray area. The registered nurse has the responsibility to be aware of such policies and practice accordingly. In situations where clear policies are lacking, it can be an opportunity for registered nurses to advocate for their development. The indicators of a professional practice issue tool at the bottom of this document on page 43 may help you assess if you are experiencing a professional practice concern. Use this list to articulate the issue and complete the professional practice form. You can print copies of this tool by visiting the online file on My RNU. Our research shows that many RNU members are aware of the professional practice definition, but lack the confidence in identifying an issue when it occurs in the workplace. It is important to be able to recognize an issue when it occurs in order for the problem-solving process to be effective. Assess your current comfort and knowledge level with the process. Personally reflect on the following questions. Do I know what a professional practice issue is? Am I aware of the professional, ethical, and legal responsibilities to report an unsafe or unethical situation? Have I read the applicable article in my collective agreement or transition agreement? Do I know where to get a professional practice form? Is there a PPC where I work? Who sits on the committee? Do I know when I should consult with an RNU representative, ARNNL, or Canadian Nurses Protective Society? Do I take the time to document my concerns? Do I know what information to include on the form to provide sufficient documentation? This is a self-assessment quiz. Do you have a professional practice issue? And can be found on page 41 of the Professional Practice Booklet. Think back to a time when you weren't sure if the issue in front of you was something you should have addressed as a professional practice issue or not. Take a few minutes to reflect on these questions. Be objective. If you answered yes to one or more of the questions, you may have a professional practice issue. You should proceed to use the process for resolving professional practice issues in Chapter 2, which we will cover in the next module. The next few slides will test your knowledge of Module 1. Close out this presentation and stay tuned to My RNU for the availability of the next learning module. Module 2, Process for Resolving Professional Practice Issues.